Hello everyone, my name is Jenny Rios. This is the patient presentation of the week number 4 and the class is APN 785. So the profile of the patient, he is a male, 77 years old. His height is 73 inches. His current weight is 170 pounds, which is appropriate in the BMI. His usual body weight, he said it was 165, and the ideal body weight is 184, which right now he's in the 94% of his ideal body weight. The chief complaint of the current admission is that this patient was transferred for another facility. The past medical history, the primary diagnosis was a left body involvement in the right brain. The secondary diagnosis was hypertension and anemia. Past hospital admission was on the last month, on October, and he had uh, the four ventricle B-cell hypophobic status post subsuctional craniotomy post right cerebral infarct. So all his labs are looking really good. I checked the electrolytes and was in within the normal levels. The blood pressure, which is the BP, was always within the normal levels. And the albumin is the only one who is kind of low. So the medication and the treatment for this patient, he's using Olikis, which is an anticoagulant, Norvasec, which is a high blood pressure control, Keppra, which is an anticonvulsant medication, Protonix. It lowers the production of the acid in the stomach. Colace is the stool softener. Mepron prevent pneumonia, and he refused Sina, which is a laxative. He mentioned that he was having problems on his bowel movement. So his social history, we don't know the occupation. The marital and family status is that he is married with two children. The education level of this patient, we don't know. So identifying the nutrition problems that the dietitian is responsible for treating is checking his lab and medication. Patient has GI functions altered, which is a constipation for the past 2 days. The nutrition assessment that I include is 25 to 30, which is because he's on the appropriate weight. And the protein needs, I gave him 1.2 to 1.5. Fluids, I put 25 milliliters per kilograms per day or per MD because of his age. So when I went to the patient and I visited him, he was looking really good. He looked skinny, but he didn't present any fat loss or muscle loss. He doesn't present any fluid accumulation. And in this facility, we don't use the grip strength. And the PIS statement that I did was increased needs, the etiology, increased demand during the therapy, and the signs and symptoms, intensive therapy at least 3 hours per day for the past 6 days. So the statement will be increased needs related to increased demand during therapy as evidenced by intense therapy, 3 hours per day, the 6 days of the week. So the intervention that I have with this patient is continue on the regular diet. Patient present constipation, so I recommend a prune juice for breakfast because his glucose were okay. He doesn't present any diabetes. And nutrition monitoring and evaluation. It's patient on regular diet with 100% of the meal intake. I also talked with his daughter, and she was mentioned that he likes the food, especially when they serve fish. He doesn't present any food allergy, which it's great. And I have the opportunity to ask her when he was eating, and I didn't see any swallowing or chewing problems, which is great. And also I see that the tray was empty. The BP, the blood pressure is within the normal levels, so we can just monitor the blood pressure. And I put for the nurses that please record the last boil movement because sometimes they don't update the chart. I also I asked the patient if he present any constipation, but he was saying like he's not constipated, but he's having a little problems to poop. So that's why I still put the prune juice recommendation. And and this is going to be my presentation for the week, and I will see you next week. Thank you so much. Bye.